When a physician or practice decides to take on panel or population management, there are a couple of processes that need to be in place. Processes that are essentially managed by front of office staff. The first and probably most important is identification of the panel. The provider needs to know who exactly is the population of patients he or she is responsible for. This becomes the provider's denominator when working with panel management. First of all, ensuring that patient demographics are accurate and up to date should be done at each patient visit or on a regular basis. When checking patient demographics, even if no changes are made, front staff should click on the Update button, as this will date stamp the demographic page with the last date the demographics were checked. Secondly, we need to ensure the patient is linked to their primary provider. This is done by entering the primary provider in the primary provider field. Finally, the most important and often overlooked action is the maintenance of patient status. Changing the status of patients that are deceased, have left the practice, or considered temporary patients such as patients seen in emergency or one-time walk-in are managed here. Additional statuses can be added by clicking on the blue file box for those with administrator privileges. Another very important step in managing patient status is identifying those patients who have not been in the clinic for some time. The clinic needs to decide at what point you inactivate these patients. For example, for patients that have not been in the clinic for 3 or 5 years. This can be done by going to the Reports section, opening up the Demographics section, selecting the status of active. Under Provider Group, select Physicians. This will allow you to include all physicians in the practice. Then open up the Visit category. Select the Not field and enter a visit date. For example, 3 years ago. You then select Patient List from your Report Type field. If administrators choose to, you can inactivate this whole list of patients en masse by clicking on the Services field, selecting Apply Demographics, Status Inactive, and then clicking on the Gears icon. This will inactivate the entire list of patients. In order to have this functionality, a user must have the batch privilege checked on their profile.